Hello everyone, today we will talk about ECG paper dimensions and sinus bradycardia. So first I will start with ECG paper dimensions. So in ECG paper we will see small squares. So we can see this big square and it has 5 small squares in it. So each small square is equal to 0.04 seconds, and if we count it, these are 5 in this square. So if we multiply it by 5, we will get 0.2 seconds. So this is important because when we count our interval, like PR interval, QRS complex, we need to know this. Only then we will know whether these are in a normal time duration or no. Next, I'm gonna talk about sinus bradycardia. So in sinus bradycardia, we have heart rate below 60 beats per minute. Rhythm will be regular. P wave is always upright and uniform. You can see here, like we don't see P wave, like if here it is upright, here we will see upright and uniform in our ECG strip before every QRS complex, so it will be uniform. PR interval, it will be in a normal limits, like from 0.12 to 0.20 seconds, and QRS, that will be also normal, that will be in between 0.06 to 0.10 seconds. Our normal heart rate is in between 70 to 100 beats per minute. So if heart rate is below 60, we call it sinus bradycardia. Although there are all other characteristics as well, like these rhythm and P waves, these should be normal. It should be normal limits. Only then we are going to call about it sinus bradycardia. We also have to look at these factors, like if we see like heart rate is 60, below 60, yeah, we will call it like heart rate will be slow, but we need to consider these factors as well to call it sinus bradycardia. So in when we have ECG, we always count our heart rate in 6-second strips. So where we count it, like when we have 15 small squares, we have 3 seconds in ECG. I think up from starting from here up to here we have 15 small squares, and this will be 3 seconds, and from here to up to here, I think these are another 15 small squares, so we have 3 seconds here. So we have a 6-second strip. Then we count our heart rate, like how many QRS complex we have in ECG strip. So we have 5 here. So we will multiply it by 10. So we have 50 heart rate. We also need to know arterial rate, like P wave. So we have P waves, 5 P waves here, so these are equal. So we have a heart rate of 50. Rhythm is regular, so P wave, PR interval, and QRS complex. We need to know these time about these P wave, T wave. Then we will call it sinus bradycardia. So after this, like there's a one more thing, that sinus bradycardia is normal in athletes and during sleep. Okay, next we are gonna talk about what is the clinical significance of sinus bradycardia. So if we have a patient who has a sinus bradycardia rhythm, we need to check his blood, check his or her blood pressure, level of consciousness, We also need to rule out that if patient has a heart disease or no, because if patient have a congestive heart failure, then this will be expected finding in that patient. Moreover, we need to see what medications patient has. For example, digoxin, beta or calcium channel blockers. These cause slow heart rate, so we need to know these when we see. Then we can rule out is this expected finding in a patient or no. Drug of choice for sinus bradycardia is atropine. It increases heart rate, and if patient is becoming symptomatic even after giving this drug, then there will be next choice that will be temporary pacemaker. So that's all about sinus bradycardia. I hope it helped. Thank you so much for watching my video.